So today I'm going to talk about the aesthetic framework. As you know, aesthetic framework is a new technology that I have been developing for the past 18 years. So today the content will be about what and why we have to do the skin framework. We have a lot of skin characteristics, but none of them is helping cosmetic laser surgeon or energy-based people, practitioner, to do their job well. They just always a guesswork. A lot of protocol. Don't know what to do next. So SLT skin framework is a technology to help to make it the skin laser easy. The conventional method drives you nowhere. Next slide, please. Slide over. So this will be in your proceedings. You can find it, but I will explain it rightly. The most common skin classification is fit practice skin types. And when you know the skin type 1, 2, 3, 4, 5, 6, but you don't know how to set the optimum parameter or laser dose for a patient. Next slide, please. The conventional classification, there are many conventional methods. There are non-invasive bioengineering tools like the colorimeters, imaging technique. This is the new technology of imaging. We have the visual and tactile methods, visual Bowman skin type system like this, and the fit practice skin type, the Glockout scale of skin aging, the Griffith photonumeric scale, and so on. And this is my technology, another technology that I have been developing for the past 3 years. That is the artificial intelligence-based skin type analysis and system. So it can simulate you to do laser well or to do energy-based well. The skin characteristic or the skin framework will be the framework for the next deep learning system technology. So the skin framework consists of two things: skin characterization, and the other thing is standard, SLT standard operation procedures. You must have the standard operation procedures, otherwise you don't do anything well, and you won't be able to investigate yourself, to check yourself whether which step is right or which step is wrong, how to improve your step or doing things. Next slide, please. In skin characterization, there are three topics. Two topics that you have to consider. First, the 3D topography of the lesion. You must know what is the skin topography, the features of the skin. What is it like to do the geometry or geography to see the land, where is the lake, where is the tree, where is the mountain, and so on. And you must have, this is a general topography. You have to see the general topography. Later you see the target. And the target, what are the targets on your face? There are many types of targets. So not a single protocol can meet the needs of each target. So the target is the size and depth, the 3D dimension of the depth, what you see and what you don't see, consistency of the target, the fractional volume of chromophores. So in laser you know only chromophore. Melanin chromophore, the hemoglobin for chromophore oxy or deoxyhemoglobin, but you don't know the fractional volume. It means that in that chromophore, that target, there is part water and there is part solid. So both solid and liquid tissue in our constituents human body, the average water is 70%. But when water comes up, the layers, the skin layers move up to the surface, the water is losing. The concentration of water is less and less till it's dry. It becomes solid, dry skin, dead cell all over the skin surface. They are all dead. No water, especially in aging people, the aged people. So you must know the liquid fractional volume. How is the fractional volume? How much of water? How much is liquid? The second thing is that for the non-target area, you must see this is target area. You have to see it non-target whether it is photosensitive. It's not skin sensitivity. It's different. Skin sensitivity is the response of general skin to any stimulation, heat, tactile, and also this is skin sensitivity, allergy to anything. It's skin sensitivity. But in laser, it is photosensitivity or photosensitiveness. Every skin has specific photosensitiveness to heat. So whether you are black, white, yellow, it's not the fibrotic skin type matters. It's photosensitive. Some people, dark skin people, skin type 5 or 6, they are less sensitive. So we can use more energy than the sensitive whiter skin of 1 or 2. So you use very little. Sometimes you cannot use it. You cannot use heat energy. You use non-heat energy. That is called photobiomodulation. Okay. So, and then after knowing these two things, then you know the SLT, standard operation procedures. You must know the objective of doing to attack the non-target and to attack the target. You must know algorithm, strategy and algorithm of how to do it, and step of lacing procedures. And there are step of lacing. This point you need this lacing pattern. Other point you need another lacing pattern. This is SOP. Next slide, please. And this is I just go through the skin condition: normal skin, dry, oily, combined, sensitive skin, aging skin. They are all classification you are accustomed to. Next slide, please. And photosensitivity. This is, you have to make a score. The my skin characterization, giving scores to all this sensitivity. There may be this type of PIH, hypopigmentation, keloid, hypertrophic scar, erythema, edema, rosacea, or any sign of this can be sign of photosensitiveness. And we score it 0 to 4 from normal skin parameter using the testing, the guideline for each energy base to test the normal person. That is the baseline. We make it their score 0. And then if you reduce the energy, the score will be increased. Okay, so this is a clinical style related scoring system. So you must know it. It's not a protocol because you have to know it, and then you see the score, and you will reduce the next step. You reduce the optimum laser dose, appropriate optimal laser dose for each scoring system. Okay, next slide, please. I just give you a brief introduction to my system. And then in the first degree of photosensitiveness, what should you do? You have to do the standard guideline and then reduce the guideline by 50% and see how is it. This is the standard operation procedure. You reduce it and you see the clinical effective side. Now the clinical effective side will tell you the scoring system, whether it responds better or worse. The scoring system, the clinical effective side is lightening and brightening. That is, if you know the laser science, fundamental laser physics, you see that when the tissue absorb energy convert into heat, and heat boil the water in the cell, and the cell bursts out the target, the solid target, and the skin is removed. The superficial skin is removed first, the dead cell, so you see lightening. Even the skin type is 5 or 6, the skin become lighter. Lighter, not whiter, lighter. You understand? Lighter, not whiter. You are not whitewashing the skin. The skin become lighter. And then brighter. Why it is brighter? Because it goes deep to the sebaceous unit, so that the sebaceous activity is stimulated. So good sebaceous activity shows the shining skin. The skin of the babies or young people are shining because their sebaceous gland activity is so good. When they are aged, this activity is reduced. And then the complication side is mild erythema. If the energy goes deeper to the papillary, the dermopapillary vessels, the vessel dilate, you see the redness. Like your face, you go to the sun become, and then your face become flushing, redness. This is erythema. Then you stop. It means that you go too far. The energy is too much, dissipated from the target zone. You have to see the thermal lock-in. In technological term for laser is thermal lock-in. Instead of selective photothermolysis, it is thermal lock-in. So this is a new theory. Anderson and Parrish theory is obsolete. Now the today theory of laser is thermal lock-in and stress lock-in. You have to confine your energy to the target area only. Don't let the energy dissipate outside the target. Okay, you burn only the target, and then then later it becomes worse and worse and worse. Become lesion, erythema, darkening of the target, peripheral darkening target. That when you are a novice. You are novices in cosmic laser, so you just see the mild erythema, you stop. Then later you see the grading of your skill, how redness is the optimum result. You see, don't drive too fast when you are just beginners or newbies. Next slide, please. This is I see you. Photosensitivity, you have to do the fast painting. This is the dynamic optimal parameter setting. You reduce the parameter or increase the laser dose by lacing pattern. You do the stacking, slow painting, fast painting, hovering, scratching, and then go and the pulse pattern. You can change the pulse pattern. The pulse pattern will give different effect to the living skin, from photothermal energy, photoacoustic, and also photobiomodulation. Okay, next slide, please. And this is you define optimal parameter first. What do you want to change first? When you do the testing, first the fluence. You set the normal fluence. For example, you set at 10 joule per square centimeters, and you see if there is erythema, myelithema, you reduce by half to 5 joule and see how is it. If it is okay, a little bit okay, you reduce, now you reduce the pulse duration. If you understand the technology or science side of laser, you see that pulse duration will make a total. If the long pulse, the total energy is increased. Shorter pulse, total energy is reduced. So by changing the pulse duration, you change the total energy. And when you change the lacing pattern, you change the pulse pattern too. Instead of pulse 2 milliseconds, stop 2 milliseconds and 2 milliseconds, you may 2 milliseconds, stop 5 milliseconds and come back for 2 milliseconds. This is a pulse pattern. So you change this. When you change this, you change all the response of living tissue, and you know how the living tissue responds by seeing the clinical sign. Okay. And thirdly is the frequency. Frequency is the number of pulse passing one point in 1 second. So if you pass through this point very often, like if you pass one pulse to this point, 1 pulse 2 joules, you get 2 joules. If you pass it 3 times, you get it 6 joules. You see, pulse frequency increase also the total energy. Next slide, please. So when you burn the target, there are many types of target. You have to choose it, and the type of this target will determine your optimal laser dose. And now we focus on the target. Just now we focus on the non-target area over the whole face. So when you do laser, don't do only this. You do only the face. Face is bright, but you have dark neck. It's ugly. So you focus on the target. There are many types of target: pigment, muscular, scar, hair, sebaceous gland, acne, skin, and skin laxity. Many people are selling energy-based ultrasound, HIFU, RF, EMS, and so on. They don't know this theory can apply to this energy as well. These are all types of energy, but how they react to the skin, you have to understand. You focus on the target. The whole face first, then when you do it, after testing you do the whole face again, like when you test it. The strategy is to remove tissue layers by layers. Layers by layers. It means that the skin is very deep. If you find one bang using 100 joules at a time to burn the whole tissue, the whole tree with the roots, you find that you don't know whether it's too much or not. You get complication. But if you slide into small things, small pieces, slide by slide, and remove slide by slide, it's much safer. So you do it, so you won't see complication. The first strategy is to remove superficial keratinocyte, activating sebaceous gland, and then later you remove the deep target. And the last one is to rejuvenate the dermis. All the skin, the damage, or especially the sun damaged skin, the dermis also is damaged. So the DNA of the dermis or epidermis, they are all damaged. So you have to rejuvenate it. The deep rejuvenation is in the last step. Next slide, please. Then when you have strategy, then you set algorithm. You have the algorithm of setting it, like I tell you before, you have to set the normal guide and then reduce by half or increase by half or increase by 25% and see the result. Next slide, please. And then this is my finding. When I teach my student, they are puzzled this theory. Usually they know that with the protocol, you just lightly lacing around the face, don't know where to go. But in reality, each target, you have to see the sixth thing you have to consider is the size in millimeter, and you divide it into 3 zones: the outer zone, the middle zone, and then the center zone, which is deepest one, the deepest one. So you remove the outer zone first. When you remove the outer zone, you see the skin is lighter and brighter. When you go to a deeper zone, the skin the zone becomes smaller. The target is smaller. And you must observe when you find the laser, the target must be smaller. If you don't make it smaller, you fail to do laser, proper laser. And the last one is the middle zone. The middle zone is where you have to be cautious. How deep it is, you don't know. You have to remove slide by slide. Next slide, please. This is one important thing is target consistency, as I told you before. It is the fractional volume of the chromophore, whether it is more solid or water. If it is water, it's solid, liquid target. If it is hard target, it is solid target. There is different technology to do it. For solid target, you have to do photoacoustic, knock it out with your hammer, like a hammer hitting a rock to make it break. But if there is a soft liquid target, you cannot knock it with hammer. You have to boil it with photothermal energy. Okay. If it is very much photosensitive, you have to do photobiomodulation. You understand? The consistency of the target determines how laser energy or energy-based other energies you have to use it. Okay, next slide, please. And then there is a solid score. Solid score, as I tell you, is a clinical sign. For normal score is 0. Normal score, you just use normal parameter. You can break it to make it become grayish snowflake, grayish white snowflake. Not too white, just grayish white snowflake. And then if you cannot make it, you increase the fluence by total energy by 20 to 100%. Their normal is number 1, 2. If you less, it's minus, and so on. And this is the classification of solid score. Okay, next slide, please. Okay, when you knock, as I tell you, when you knock the solid target, you get cavitation like this. Don't be afraid. And you see the periphery is lighter, and you see the dark area. This is the liquid area absorbed, and it become darker. This is fine. This is fine without lesion, edema, erythema, or purpura. This is fine. This is fine. For a liquid target like acne PIH, when you boil it up, it becomes darker, mild darker. If it becomes very dark, it will become blister, ulcer later. So this is the grading of the clinical sign that you have to observe. Next slide, please. This is a pigmentation. This is pigmentation like melasma and solar lentigo or lentigenes. How to manage it. Next slide, please. We have pigment score. Score -2, normal parameter causing hypopigmentation. This is pigmentation score. It becomes hypopigmentation. You have to be aware. There are a lot of cases of hyperpigmentation after laser and later turns into hypopigmentation. So if you immediately make it white at one stroke, one stripe, you score it -2. Okay, then later the score increase to after +4. +4 means that sometimes the pigmentation score is too low as score plus is too low. It means that you need low energy, but the score is high. You may use the lowest parameter, lowest range, lowest pulse duration, lowest frequency, and you have to lift up the distance above the skin. Usually the laser is determined to do 1 centimeters above the skin, but you may need to lift up to 30 centimeters or 2 feet over the face, and you have to do the fast painting and long spacing of the pulse to see the effect of lightening and brightening. The score is +4. I have seen all this score in my life, so that I make this score for you. Okay, next slide, please. Then the depth of target. There are 2 parts, as I told you. What you see and is what you don't see. For the wise people, they will remove what you see first, and then you do a little by little the deeper part, what you don't see, and what you don't see will be seen, observed by clinical science of usually what you don't see in liquid target is mild darkening and become moderate darkening and become severe darkening and become purpura and become blister. You see, these are the process of the deep part, the one you don't see. Next slide, please. And this is the target type. You have to see in what this is for vascularization. Just now I told you the solid, the pigment lesion. Now for vascularization, you have to see the type. Characteristic is the blood vessel type, the broken vessel, the vein or the artery, the size of the vessel, and the optimum dose. In vascular lesion, what you need to know is the depth of the vessel. The deeper the vessel, the bigger the vessel, the more energy you need, the more complication you will find. So, believe me. Okay, next. And vascular type, whether it is vein or arteries, what type of vein? Small vein, medium-sized vein, and big-sized vein or arteries. Okay, we classify into types. You see, because the big vein or the vein is different from arteries because of the muscle layers. Vein has thinner muscle layers. For venous, no muscle layers at all. But for arteries, even arterioles, there is muscle layers and thicker muscle layers. So the energy passing through the three walls, three layers of the vessel, the tunica, the serous layer, the muscular layer, and the endothelial layer, and also the protein content to coagulate the protein intravascularly. The energy, what we call it, the degeneration temperature. The outermost layer, the serosa layer, needs less degeneration energy than the protein intravascular. So if you don't give appropriate energy, the serosa break first. What you see if the serosa or the muscular layer breaks, you find purpura, and then you get PIH followed. Okay, next slide. Next slide. So you have to set optimum parameter for each. And the scar also, you have to classify the scar into types. For example, the acne scar, they classify so many, such as ice-pick scar, box scar, lowering scar, and so on. You have to classify and how you can apply optimum laser dose or optimum parameters, optimum dynamic parameters to all these classification. Okay. And in wrinkle also, you have to classify the wrinkle. Next slide, please. Okay, in summary, you need target topography is the consistency, the depth, size, and shape, and also the other thing is attachment is very important. The target attachment to the deeper layers. If the attachment is too strong, you need more energy, and you have the possibility of breaking the skin. Especially, you don't know. In my finding, you will see the skin on the left side is different from the skin on the right side. The skin on the left side of pigmented people, there will be what we call it cement or hyaluronization. Sometimes you see carbonization over the skin, and it's very difficult to break it. You must have the technology of removing all this cement on the skin. Next slide, please. This is the, for example, for the normal skin, you test the standard, you adjust the optimum parameter setting, and then later you do the dynamic optimum parameter setting. You see, this is a lacing pattern, and you observe whether the skin is brighter or not. If it's not brighter or any complication, you change it into the you just find mild, moderate, mild darkening, and then you have to reduce. Otherwise, you can increase. Slide. Next slide, please. You increase to this parameter. You see, and then this is the chart. Is you focus on the each spot, the black spot. Next slide, please. You just knock the hard spot, the stony spots. Okay, next slide, please. and then you do the deep layer with longer wavelength, like 1064 nanometers. And in removing the deep layers, you have to do the fast painting around to see the 3 zone of the target, reduce inside, lightening on the periphery, and mild darkening of the center. Next slide, please. Okay, this is my new book. I've been preparing for the past 2 years, writing this book, and it's about to publish it. I'm finding a publisher, and I'm reviewing the videos inside, because I have more new videos that should be appropriate for all this. Nowadays, there are more than 200 videos of this book, so that you can know each step of doing it, the science and arts of cosmetic skin laser surgery. Thank you very much.